Let's start with schizophrenia. Schizophrenia, or in short, we call schiz. The topic composed of introduction, etiology, DSM-5 diagnostic criteria, treatment, antipsychotics, both first gen and second gen, adverse drug reactions, mechanism, guide to a drug selection, and finally, pharmacist role. Let's know this disorder name, okay? We call it schizophrenia. In Thai, we call จิตเภท Schizophrenia is one type of thought disorder. Thought disorder, that means the abnormal about thinking. Unlike depression we call mood disorder. Mood disorder is abnormal about emotion, okay? The term schizophrenia comes from two words. Schizo, that means split. Phrene, that means mind. That means the body and mind is split apart, okay? Like someone think he is someone else, okay? Now let's talk about this. The term disorder. When we talk about disorder, that means we don't know exactly what's cause or what is definite etiology, okay? Like a schizophrenia, we don't know exactly. But if we talk about disease like pneumonia, we know exactly which microorganism that cause pneumonia. Okay, so that's all about the term, okay? Okay, this is some additional term you have to know, okay? The first term, illusion. Illusion, in Thai we call ภาพมายา It can be a sight or sound, okay? Like on the illustrate, when someone see something like a rope and they misinterpret like they see a snake, so we call this illusion, okay? Misinterpretation of real stimuli. In this case, you have something real, but you misinterpret it. Next one, hallucination. Hallucination, in Thai we call หลอน Hallucination, the characteristic of it mean you have to get it by sensory organ. Sensory organ like an eye, okay? See by eye, hear by ear, smell by nose, and touch by your hand or your skin. Okay? So hallucination, firstly, you have to feel like is come by sensory organ, okay? Without real stimuli. That means nothing there, but you feel it's there, okay? We call hallucination. Usually hallucination is just a short period of time, okay? Not permanent. Like you go into the restroom, okay? And in the mirror, you saw someone, okay? In just a few seconds, you can saw it. So it's like something just appear in the short period of time, okay? In hallucination, we divide it into two main type. Auditory, that means you hear something that is not real. Olfactory, that means you see something that's not real, okay? In schizophrenia, most of the patients have auditory hallucination. This is the main symptom. But someone have olfactory, it can be. But in the drug addict, olfactory hallucination is a predominant. Okay. Now we talk about delusion. Delusion in Thai called หลงผิด. The nature of delusion is fixed false belief. Fixed false belief, that means the misunderstand is like permanent, okay? in a long period of time. Like someone think they are Superman, okay, and he really believe it for a month, okay. So this example we call fixed false belief, and inside mind that means it can come up in your brain or in your mind, do not need to pass the sensory organ like hallucination, okay. We call this delusion. I have some example from my cousin, okay. Okay, he graduated from KKU, and just one day he said he think he's not he said he know that his parent is not real. He was born by another couple, okay, and he tried to find the real parent in 2 or 3 or 4 months in a row. So at the end, the doctor diagnosed him like a Schiz, okay. That's the example of fixed false belief. The book called DSM-5. DSM-5 stands for Diagnostic and Statistical Manual for Mental Disorder. Someone think DSM-5 is guideline. It's not true, because guideline have to have a content of treatment, okay, and option of the medication selection. But DSM-5 is just diagnostic information and statistic of the disease in last year, like how many person have depression, how many person have schiz, okay. That's a statistical manual. This book is very important because psychiatric disorder, we have no objective parameter, okay. So you have to read and interpret and then give a diagnosis. Lifetime prevalence or ความชุก of schiz, okay, it's up to the source, okay, but on the screen tell you that 0.3 to 0.7% of population, or roughly 1% of population. That means 100% in general population, one of them have schiz, okay. We call lifetime prevalence. Onset, usually we found that the sign and symptom begin in this period, late adolescence to early adult, might be 13 year old to 25-year old. Okay. Etiology of schizophrenia. Okay, because of we call schizophrenia is a disorder. That means we don't know exactly what the cause. We just have the hypothesis. Okay, there are many hypotheses. Firstly, neurodevelopmental model. They talk about the abnormal of gene or neurology development. The second one, dopamine or mean D2 receptor. Dopamine D2 hyperactivity. This is the main hypothesis from the past, okay? But for now, when we discover second generation, so dopamine hyperactivity is not the main hypothesis. Genetic, okay? Many research study can prove genetic correlate to disease. Environmental factor and stress. And the last one, Toxoplasma gondii infection. Okay, Toxoplasma gondii is parasite in some pets, okay, like a cat. Okay, we will talk the detail one by one. Start from neurodevelopmental model. In this model, there are two waves or two hits, okay. Firstly, when the baby in pregnant women, okay, we call early insult, maybe the abnormal gene or maybe environmental like a toxin, okay, or hypoxia or something that cause the abnormal in neurological development in baby, okay. When the baby was born, then abnormal come with him, okay. How do we know? There are some trigger, but usually this trigger we know by retrospective method, okay. Cognitive deficit, that means sometimes the children can calculate something slowly. Mood, some students show some depressed sign and symptom, okay. Social isolation, school failure, maybe he got the F grade too much, okay. That's in the childhood. When he go to be adolescent, okay, this time we call second hit. Second hit maybe come from the second gene. Maybe some scientists think there are two set of gene, okay. The first one expressed when they are in the pregnant woman, okay. The second one expressed when the children go to be adolescent, or environmental like stress or the family problem or something, okay. When second hit come, many patients show the sign and symptom of schiz. The next hypothesis, dopamine pathway, okay. There are 4 pathways of dopamine in the body or in the brain, okay. You can see this slide and the next slide. Okay, let me show the next slide before, because I typed the explanation in the next slide already, okay. Let me go back to previous slide, okay. When you see this slide, I showed you 4 pathway of dopamine, okay, in the body, and I mark the number for the pathway. Pathway number 1, 2, 3, 4. This number is not universal number. I just mark for you to easily learn this subject, okay. If you follow by this number, maybe you can remember it easily, okay. When we talk about the pathway of neurotransmitter, we talk about the beginning and the target. Like the first one, mesolimbic. Meso, that means midbrain, okay. You see this neuron, okay. They start from midbrain and go to limbic system of the body. What's limbic system for? Limbic system responsible for the dream, okay, and the imagine or anything. But the schiz patient, this pathway is like an overaction. So when you imagine too much and too much, it can cause you delusion. So the first pathway we call mesolimbic, okay. Second one we call mesocortical. Mesocortical, okay, start from midbrain, okay, go to the prefrontal cortex, okay. Prefrontal cortex is responsible for the memory and emotion, okay. The third pathway, nigrostriatal. Nigrostriatal start from substantia nigra, go to the area we call striatum, okay. Striatum is the area that control the movement of the body. So if you can link to EPS, you have a clue that striatum in this area is related to extrapyramidal side effect, okay. The last pathway, tubuloinfundibular pathway, this pathway originate from the hypothalamus, okay, and go to pituitary gland. The function is control the prolactin release, okay. Okay, that's all about the 4 pathway. Let me point something for you. Okay, first pathway, dopamine hyperactivity is related to positive symptom. The second pathway, dopamine hypo, not hyper. When dopamine hypoactivity is related to the symptom we call negative symptom and is impair cognitive function. Nigrostriatal, okay, is control motor function. When the drug inhibit this pathway, it can cause EPS. And the fourth one, tubuloinfundibular, okay, that means tubular region of hypothalamus and infundibulum of pituitary gland. So the name comes from the beginning of the development of this organ. Okay, this pathway is control the prolactin release. That means when you give them antipsychotic drug and it's block this pathway, so prolactin release more and more. We call hyperprolactinemia. Okay. Next, the genetics. The genetics. Okay, this chart tell you that the percent or chance of you to go to be schizophrenic patient. Okay. Let's see like this. When yourself compare with general population, you have a chance of 1%. That is the number of prevalence, okay? 1% of population. If your uncle have schizophrenia, that means you have a chance to go to be schizophrenic 2%, okay? And if your parent, one of them have a schizophrenia, you have a chance increase to be 6%. And if your both parents, father and mother, have schizophrenia, you have a chance 40% to be schizophrenic. And if you have a twin, let's see, okay, identical twin, that means twin that come from the same egg. When the first twin have schizophrenia, the other twin have a chance 48% or almost the half. So from this chart and this data, okay, is confirmed gene or genetic related to the schizophrenia. Okay. Next one is a research study. This one is very classic research because it took a long time, almost 20 years. Okay, some researcher dead before the research was done. Okay, they call this in short adoption study. Adoption study, they try to compare the genetic or environmental impact on schizophrenia. Let's explain like this. Okay, the real parent in this research they call biological parent. The real parent have a child, okay, but this family cannot afford or cannot give the resource enough for the child, so they give the child to another family we call adoptive parent. Okay, the metaphor look like this. The real parent or biological parent represent the gene, okay, the gene effect, but adoptive parent represent environmental effect. Okay, and the researcher follow up the children until they grow up. Okay, the result look like this. If biological parent or real parent, both of them have schizophrenia, they increase the chance of the child to be a schizophrenic. But if adoptive parent or represent environmental factor have schizophrenia, the chance of schizophrenia of the child not change. Okay, so from this study they conclude that genetic is a crucial factor that cause the schizophrenia. Okay, but it's not mean environmental factor is not important, but because another study show that. Next slide, I talk about environmental factor and stress. Okay, there are many studies show that environmental factor and stress can activate the Schiz symptom. Okay, like a fetal hypoxia. That means that some hypoxia when the baby was a fetus. Maternal infection, like a pregnancy woman have some infection, and that infection go to be destroy or block some nerve development. Okay, child abuse, stress and trauma, family environment, cannabis use, or drug addicts or something. Okay. The last hypothesis. This is the very interesting topic in the some period of time. But for now, for meta-analysis, we know that is have just a weak link. Okay, but at that time we found that toxoplasma is parasitic infection. Okay, when you interview the Schiz patient, we found that most of them have a cat at their home. So two studies try to find the correlation, and they found that bipolar patients have exposed to the cat in the childhood. Okay, and they come through this toxoplasma gondii effect can affect animal and human behavior, because when they infect this parasite to a mouse, the mouse change the behavior from the calm mouse to aggressive mouse. But many study later, okay, they found no correlation. So this topic still controversy now. Okay, that's all about etiology of schizophrenia.